The World Health Organization's Regional Director for Africa, Dr. Matshidiso Moeti, has emphasized the importance of gender equality, women's empowerment, and the right to healthier lives. Reflecting on this year's theme, Invest in Women, Accelerate Progress, he highlighted that the WHO has collaborated with regional partners and civil society stakeholders to address barriers impacting gender equality in healthcare access. These initiatives focus on overcoming socioeconomic, systemic, and political barriers hindering gender equality in healthcare. These efforts have led to significant improvements in the health and well-being of women and girls across the region, with life expectancy of women increasing from 54 to 67 years between the year 2000 and 2020. Maternal mortality ratio decreasing by 33%, and proportion of women satisfied with modern family planning methods increasing from 47% to 56.5% in 2020. To discuss this, we are joined by Dr. Chioma Nwakaman Akano, also known as Dr. Zobo, representative health physician and founder Smile With Me Foundation. Thank you for your time.
Thank you very much. Good evening.
All right, now, from your medical, expertise, what are the key challenges that still need to be addressed to achieve universal access to sexual and reproductive health services?
Okay, thank you very much. I'll quickly group them into three. I would say the people, the government, and society as a whole. As per the people, one of the major challenges to scale this barrier would be education and empowerment. A lot of people are not educated and sensitized about their health and their rights. Then the government has a huge role to play in ensuring that the social determinants of health, are available. And just as Dr. Moeti said today, the WHO Regional Director for Africa, he highlighted that priority funding is low. So one of the key challenges that we face is funding. So priority funding should be channeled towards healthcare, especially women's healthcare, sexual and reproductive healthcare. Then we have society, social, cultural, and religious biases in our society, which I believe pose the bulk of the challenge when it comes to carrying out our performances, our services, both as healthcare professionals and the health-seeking behavior of Nigerians and Africans generally.
Now, some women are not even aware of these rights and services available to them. Can you mention some of these rights and services?
Okay, good thing you mentioned. I think earlier today I shared some rights, and these are not, this list is not exhaustive, but I'll just share off the top of my head about 7 of them. And these rights are both from the Patient's Bill of Rights, the Constitution, and also cutting across the Hippocratic Oath. The very first thing is that every woman has a right to chaperone, but everyone, including women, have a right to chaperone during a clinical examination. And if you are not given one, you should demand for one. And secondly, I think this still baffles people. However, women need to know that they have the right to sign their consent forms for any medical procedure, as long as the doctors have determined you conscious and alert, able to make those decisions, you can sign it. And if you decide to delegate, that is totally up to you. It's your choice. Then thirdly, you have the right to question your management plan. This is actually number 1 in the Patient Bill of Rights. And also, professional second opinion. You have the right to seek a professional second opinion if you are not satisfied with the first opinion of your healthcare professional. And women also have the right to pain relief for painful procedures. And sixthly, we have the right to wash facilities. That's water and hygiene facilities in our schools and workplaces. And finally, women have the right to paid maternity leaves. This is also under the Nigerian Labour Act in our constitution. So off the top of my head, these are rights that women should be educated on and armed with when seeking and while seeking health care.
All right, my final question, but I'd appreciate if you can respond in 30 seconds. In what context of the International Women's Day can the medical community further contribute to advancing gender equality and also women empowerment, particularly in healthcare?
Firstly, every medical professional should familiarize themselves with the Patient Bill of Rights and uphold the Patient Bill of Rights. It's not about your mood, what you feel, or how tired you are. Then secondly, educate yourselves. And also, I think availability of data across medical personnel and different facilities will be really helpful. And generally, stakeholder collaboration within the healthcare system is something that we should uphold. Yeah.
All right, Dr. Chioma Nwakaman Akano, also known as Dr. Zobo, reproductive health physician and also founder, Smile With Me Foundation. Thank you for your time.
Thank you for having me.